Cloverdale, Langley City.
Mr. Speaker, I rise in the House today in support of Bill C-14, an act to amend the Criminal Code and to make related amendments to other acts, also known as Medical Assistance in Dying, or MAID. In January, I was appointed to the Special Joint Committee on Physician-Assisted Dying, and I was honoured for the opportunity to be part of this important discussion in Canadian society. Over the span of a couple of months, my fellow committee members and I spent a lot of time working to understand the complex issue of medical assistance in dying. We discussed, we debated, and we even disagreed on a few issues, but in the end, we drafted a report that I felt was the best possible solution for this complex social and legal issue. Drafting any legislation can be difficult, but it becomes especially difficult when the title includes death or dying. It's a topic that most of us are sensitive towards, and many have difficulty confronting. Within the Special Joint Committee, we dealt head-on with a number of difficult issues and were immersed in them for 6 weeks. We reviewed reports by the Provincial Territorial Expert Advisory Panel on physician-assisted dying. We heard from healthcare regulatory bodies throughout Canada and the Federal External Panel on options for a legislative response to Carter versus Canada, to name a few. We had the challenging task of grappling with a few major issues touched on by Bill C-14, which included the availability of medical assistance in dying for mature minors, patients with mental illness, advanced consent, conscientious objection, and inevitably ensuring that adequate safeguards were in place to protect the vulnerable. On February 25th, the Special Joint Committee reported back to Parliament, where the Ministers of Justice and Health took the report into consideration and began drafting Bill C-14, which is what I am here to discuss today. Bill C-14 reflects a number of recommendations made by the Special Joint Committee, and these include 6 main points: allowing both euthanasia and assisted suicide, being permanent residents of Canada so as not to encourage what some have coined as suicide or death tourism, requiring a written request for medical assistance in dying, requiring 2 witnesses during the time of request, requiring confirmation from 2 doctors or nurse practitioners that the person making the request meets all of the criteria for medical assistance in dying, and finally requiring a mandatory statutory review. The key message I have taken from this very difficult discussion that I was part of, and that Canadians are now joining, is that this has to be a patient-centred discussion. I encourage all parliamentarians to set aside personal values and beliefs and focus on what is in the best interest of patients. Medical assistance in dying is and should only be about the patient. Upon reflection of our committee work, I now realize that the committee managed to develop a higher level of comfort with this difficult topic that is held by many Canadians at this point in the public discourse on medical assistance in dying. So I'm glad to see that the government took the overarching perspective of Canadians into consideration and is willing to use this legislation as a stepping stone for further studies and future revisitation. In the past few months, I've hosted and co-hosted medical assistance in dying town halls. I've spoken directly to my constituents. I've listened to the concerns of my constituents and of many Canadians from around the country. And just last week, there was a demonstration for Bill C-14 held at my constituency office. I've heard the positive, I've heard the negative, the concerns and the support, and although I fully support this legislation, I believe there are voids that have yet to be filled. Firstly, the demonstration last week, at the demonstration, an important criteria, or better yet, a lack of criteria of the bill was brought into question. How does one maintain safeguards when dealing with non-medical personnel? Bill C-14 ensures protections are met for non-medical personnel who participate in medical assistance in dying, including those who aid a person at that person's explicit request to self-administer a substance prescribed as part of the provision of medical assistance in dying by amending Section 241 of the Criminal Code and introducing Section 227 to allow medical assistance in dying if the appropriate conditions are met. But what is being done to ensure that non-medical personnel are in fact following the guidelines required by medical assistance in dying? For instance, right before the time of administering the lethal prescription, a patient must be asked whether they would like to continue with medical assistance in dying. But how do we know that these independent individuals are in fact asking this question among others? How do we know that the individual will not take advantage of the situation or the vulnerable position that the patient is in? These are questions my constituents would like to see addressed. Secondly, I recently spoke to someone who is heavily involved in the Carter versus Canada case, who was wondering whether Kay Carter herself would have qualified for medical assistance in dying given the legislation being discussed today. I've read articles stating that she would have been, because she met the criteria for eligibility. But would healthcare practitioners consistently agree that Kay Carter would indeed have qualified under this legislation? The part that I'm finding difficult to grasp for Kay Carter and many others is the ambiguity of the criterion for imminent death. How do we know that individuals will not be turned away from the service of medical assistance in dying because of the vague nature of this criterion? Who is responsible for deciding the criteria for imminent death? Will there be inconsistencies in the definition of imminent death? And how will we as society address these? Lastly, the hard timeline between the date of request and the day on which medical assistance in dying would be provided was yet another point of concern. Many constituents have expressed concerns that this may lead to the hastening of death because the timeline was simply too short. The Special Joint Committee had recommended a flexible waiting period, which would depend on the nature of the illness as opposed to just an imminent death. It would be suggested that imminence and competence not be the only factors in determining the timeline, but much rather the rapidity of progression and nature of the patient's medical condition be used when determining the reflection period. These are a few pieces of the proposed legislation that my constituents and I feel need to be clarified and tightened before the final legislation is created for June 6, 2016. However, I also want to acknowledge that the legislation has done a great job in addressing a number of concerns that have been conveyed by my constituents and many others. For instance, the first misconception that I would like to clear up is that Bill C-14 does not address the conscientious objections of medical personnel. It does. There is nothing in the proposed legislation that would compel a healthcare provider to provide medical assistance in dying or refer a patient to another medical practitioner. Balancing the rights of medical providers and those of patients is generally a matter of provincial and territorial responsibility, and we need to respect that. However, that being said, the federal government has committed to work with provinces and territories to support access to medical assistance in dying while respecting the personal convictions of healthcare providers. Bill C-14 also recognizes the autonomy of persons who have a grievous and irremediable medical condition that causes them enduring an intolerable suffering and who wish to seek medical assistance in dying while recognizing the importance of protecting the vulnerable and ensuring adequate safeguards are in place. Over the past 4 months, I've encountered a wide variety of perspectives about this complex and difficult issue. Some have been extremely restrictive, while others have been extremely permissive. Some believe the legislation goes too far, while others believe it does not go far enough. I believe C-14 is an important first step in Canada. It's cautious, even a conservative piece of legislation, but it provides a necessary first response to the Carter decision, along with a commitment to continue studying the effects and revisiting important issues of medical assistance in dying in the future. Ultimately, when it comes to Bill C-14, I would like to see the voids found within the legislation to be addressed prior to June 6th, and I intend on supporting Bill C-14. I encourage my colleagues on both sides of the House to support the rights of Canadians and to put patients first by supporting this bill. Thank you, Mr. Speaker.
Questions and comments?